Prosopagnosia, face blindness, understanding the brain struggle with faces. Presented by Amal Abdul. What is prosopagnosia? It's a neurological disorder affecting facial recognition. People cannot recognize faces, even familiar ones, such as their family member or their friends. They cannot identify their own face in the mirror in severe cases. This is only in the very severe cases, and it's very rare. Vision and memory are normal, a specific recognition issue. So basically their vision and their memory are totally fine. They just have a recognized issue. Types of prosopagnosia. The first type is congenital, developmental. This type presents from birth, no brain injury, often runs in families. This type is actually very rare. The most cases of prosopagnosia is acquired, which is the second type. The second type is acquired, caused by brain injury, such as stroke or trauma. Affects the fusiform gyrus in the temporal lobe. How it affects daily life: difficulty recognizing friends, family, co-workers, or even themselves. Relies on clue like voice, clothing, or context. Can lead to social anxiety and embarrassment. There is actually a huge relationship between prosopagnosia and social anxiety, because people who have this syndrome usually tend to avoid interacting with people. Many people are unaware they even have it. Many people would assume that they just have a short memory, which is not true. They might have actually this syndrome. Who has it? This syndrome affects about 2% of the population. Famous cases. Number 1 is Dr. Oliver Sacks, neurologist. The second person is Brad Pitt, which is actor and self-reported. Brain region involved: fusiform gyrus and the inferior temporal cortex, specialized for face perception. Damage to this area, which is prosopagnosia, shown clearly in MRI brain scan studies. Coping strategies: using voice, hairstyle, or clothing to recognize people. They can recognize people by making something special about them, like their skin color or their voice. Forming friends, family to avoid misunderstanding. When the family and friends are more understanding of the case, they can help the patient. Technology like labeled context photo can help. Support group and therapy can reduce anxiety. People who have this syndrome often have so much anxiety because they go through so many embarrassing situations because they can't recognize faces. Interesting facts: people with prosopagnosia can sometimes recognize emotional expression. For example, they cannot recognize the face, but they can recognize that someone is mad or someone is sad. So they can know the expression, but they cannot know the person. In conclusion, prosopagnosia, also known as face blindness, makes it hard for people to recognize faces, even of those they know it well. It can cause by brain injury or be present from birth. Although there is no cure, people with prosopagnosia can learn other ways to recognize others. Here is the references that I used to make this presentation. Thank you so much for your listening.